Welcome to The Explainer. Today we're going to do something a little different. We're stepping into the shoes of a medical detective. We've got two really fascinating clinical cases, and we're going to see if we can follow the clues to crack them. Let's get into it.
So, here's the deal. Your mission, should you choose to accept it, is to follow the evidence. We're talking symptoms, scans, lab results, the whole 9 yards. We're going to uncover the truth behind two very different medical mysteries. It's all about weighing the evidence and really getting inside the heads of clinicians as they make these huge, life-altering decisions.
Okay, let's crack open case file number 1. We've got a 62-year-old woman, and right off the bat, the clues from her physical exam are, well, they're pretty significant. These first findings are going to set the whole investigation on a very specific track. So, let's look at what we've got. You see a list of things here, but a few of these just jump right off the page. An immobile mass? Yeah, that's always a red flag. But then you see a retracted nipple and this pea d'orange, which literally means orange peel skin. You guys, these are classic textbook signs of something more advanced going on. These aren't subtle hints. They're more like giant, flashing neon signs.
Okay, so the team doesn't just guess. They follow the procedure, step by step. First up, the mammogram. It shows this angry-looking mass with spiky edges, what doctors call spiculated margins. That's a bad sign. Then they bring in the ultrasound to get a closer look. It confirms, yep, this thing is solid and irregular, not just a simple cyst. But imaging can only tell you so much. To really know what's going on, you need a piece of the puzzle itself. And that means it's time for a biopsy.
And there it is. The biopsy results come back, and it confirms their worst fears. Invasive ductal carcinoma. We're talking about a locally advanced breast cancer. So the what is solved, but now comes the what next. And believe me, this next decision is just as critical as the diagnosis itself. It's about figuring out the absolute best plan of attack.
So, diagnosis confirmed. We're at a crossroads now. The treatment path. And this is a really, really crucial choice. It's not just about what treatments to use, it's about the order you use them in to get the best possible outcome.
So this is the big question, right? The one the whole team is debating. Do you rush this patient into surgery, or do you start with something else first? And I want you to really think about this. It's not just some abstract question. This decision is going to define the patient's entire journey from here on out. So, what would you do?
And the answer is neoadjuvant chemotherapy. This is a really smart strategic move. See, instead of going straight to surgery, the idea is to shrink the tumor first. It's called downstaging. Think about it. A smaller tumor is easier to remove completely. But there's another huge advantage. This chemo goes through the whole body, so it's also hunting down any sneaky cancer cells that might have already started to travel.
All right, let's put that case to bed for a moment and open up case file number 2. And this one is a whole different ballgame. It starts with a clue that isn't subtle at all. In fact, it's pretty dramatic. Yeah, that'll get your attention, right? Bloody nipple discharge is one of those symptoms that makes everyone, patient and doctor, sit up and take notice. It's an immediate priority. So our patient is a 45-year-old woman, and she has this, plus a firm, mobile mass right behind the nipple. So the team swings back into action. They're using the same playbook, the same diagnostic tools, but the clues they start finding this time around, they start to paint a completely different picture from what we saw in case 1. Let's take a look. Okay, check this out. The results are in, and the contrast is just stark. Remember that angry, spiky mass from before? Well, this one is well circumscribed. That means it has smooth, clean borders. And the biopsy? It comes back showing only benign cells, non-cancerous. So even though that first symptom was super alarming, all the new evidence is pointing in a totally different direction. So let's do what any good detective would do. Let's line up the suspects. Could it be an invasive carcinoma? Nope. That doesn't fit the mobile and well-circumscribed evidence. How about a fibroedema? Unlikely. That almost never causes bloody discharge. But an intraductal papilloma? Bingo. It checks every single box. And this is the key takeaway, right? The first symptom was terrifying, but the full investigation, it tells a much, much less scary story.
And just like that, mystery solved. The culprit is an intraductal papilloma. It's basically a little, non-cancerous growth inside a milk duct. This case is just a perfect example of why you have to do a full investigation. You just can't judge a book or a medical case by its cover.
Okay, so let's debrief. We had two cases that went in completely different directions, right? But both of them relied on the exact same set of diagnostic tools. This is the playbook. And if you want to think like a medical detective, you got to know the tools of the trade.
First up, the mammogram. This is like your first sweep of the crime scene. It's the aerial surveillance photo that gives you the big picture, the lay of the land. It's great for flagging any suspicious areas that need a closer look.
So once the mammogram flags something, you send in the ultrasound. This is like sending a scout on the ground to get more detailed intel. It's fantastic at figuring out the composition of a lump. Is it solid, like we saw in our cases, or is it just a simple fluid-filled cyst? The ultrasound can tell you that.
And then you have the biopsy. This is the gold standard. It's the smoking gun. It's when the detective finally gets their hands on the physical evidence, the tissue itself, to examine under a microscope. This is what gives you the definitive proof you need to make the final call and officially close the case.
So, after all that, what's the big takeaway? What's the #1 rule for any medical detective? It's this: the first clue is never the whole story. You saw it yourself. A super scary symptom can turn out to be totally benign, while something that looks subtle can be really serious. You have to follow the evidence. A thorough, step-by-step investigation is the only way to find the truth, because in medicine, the most dangerous thing you can possibly do is assume.